You're listening to Episodes, a podcast from the Cyclic Vomiting Syndrome Association.
Please be aware that the content of this podcast is created for general, informational, and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
The opinions, perspectives, and experiences shared by our guests, including medical professionals and scientific researchers, are solely their own and do not necessarily represent the views or official policies of their respective institutions, employers, professional organizations, or any other entities they may be associated with.
Their appearance on this podcast does not constitute an endorsement by the Cyclic Vomiting Syndrome Association.
Furthermore, neither the Cyclic Vomiting Syndrome Association, its board of directors, employees, volunteers, hosts, or anyone associated with this podcast takes responsibilities for any actions or inactions on your part based on the information provided.
We do not endorse or recommend any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned.
Thanks for joining us today on Episodes, a podcast by the Cyclic Vomiting Syndrome Association. Each episode, we hope to bring CVS perspective or information about CVS that will increase awareness, spark conversations around CVS, and ultimately change the way that cyclic vomiting syndrome is seen and understood. I am your host and president of the Cyclic Vomiting Syndrome Association, Belinda Killian. I'm also a parent and caregiver to a person impacted by CVS. Joining us today, we have Dr. Patrick Reeves. Thanks for joining us today, Dr. Reeves.
Thank you so much for having me. I'm very excited.
You have a very impressive bio, triple board certified. Can you kind of share a little bit about what that describes, I guess?
Yes, ma'am. So I am a lifelong learner, a husband and father with a wonderful wife who has encouraged me to follow my passions. And so I actually am hoping that by Christmas I am quadruple board certified, but I am a general pediatrician, also board certified in pediatric gastroenterology and hepatology. I have a specific focus in disorders of gut-brain interaction, specifically in the research of cyclic vomiting syndrome. I am thirdly board certified in obesity medicine. So my particular niche area is the child born with genetic causes that increase obesity and the use of medicines and surgeries under the age of 12. And then I'm hoping to become board certified clinical informatics. Took that test a week ago. And that is essentially the use of clinical decision support, consumer health information, and digital health, and bridging those two to improve patient outcomes. Enter the Cyclic Vomiting Syndrome Action Plan.
That's awesome. I love that. Lifelong learner. I do that too. I can't stop. There's got to be. I don't know what else I would do with my time, right? So
yes, ma'am. I totally agree.
I love that. Okay, and you are an associate professor of pediatrics at Long School of Medicine at UT Health San Antonio, Texas, and Uniformed Services University of Health Sciences in Bethesda, Maryland. You're also an associate professor at military medicine at Texas A&M University Health Science College Station, Texas. Man, all I can say is I'm fingers crossed for the fourth one. I'm pretty sure you'll get it. I've seen your enthusiasm and drive, so definitely, you're a driven person. I love that.
Thank you so much.
So you have a specific niche research focus over the last 10 years that you were talking about for that intersection. You also have your own consulting firm.
Yes. So I have the Wild Child Medicine Consulting Firm, and it is a name that my children selected. We were in the car driving to dinner, and my wife said, you should probably form a company. And I look in the rearview mirror at my then 5 and 7-year-old. They're going crazy in the back seat. Mm-hmm. And I said, all right, Wild Kids, what should the company be named? And they said Wild Child. So I, they got Wild Child. I threw medicine in there. It was great. And then my daughter scribbled the logo. I put it through ChatGPT, showed it to a family friend. She drew it in the amazing sort of zoo environment of the logo was brought to life.
That's awesome. That's great. They're totally involved in that, so I bet you that they're invested as well.
I think so. Yes, ma'am.
Okay, so the CVSA Action Plan, I know you had originally reached out to CVSA about developing an action plan for CVS. You worked with a lot of CVSA's medical advisory board to develop one. Can you start by sharing a little bit about what drew you to working with patients with cyclic vomiting syndrome?
Absolutely. So I was a first year fellow in Washington, D.C. at Walter Reed National Military Medical Center. And I just became enthralled and invested in the care of pediatric and young adult patients with disorders of gut-brain interaction. And there came a point during the pandemic when we lost the ability to have that face-to-face interaction with these patients who had such acute and chronic needs. And when we shifted that care to a predominantly virtual model, there was something lost in that communication. It became really difficult to, especially for cyclic vomiting syndrome, talking about all these different medicines, the stages of disease, and how to help people feel better at home. And so I knew there was something missing. And I started more simply, I guess, and was having a similar problem in the management of people with constipation. So we developed the constipation action plan, set up in the same way as the CVS one inevitably was, with green for good, yellow for bad, red for worse, really step up therapies each and every point along the way. And the constipation plan was highly successful, and parents and patients alike really enjoyed it. And our outcomes based on randomized trial were better. And so I sat back in my chair. My mentor and I were having a research meeting, and Dr. Rogers, my mentor, said, we really need to expand this to other pathologies. And at that point, we were nervous about biting off more than we could chew. But my response as a very excited fellow was, we should start with the most difficult thing of all, the thing that means patients are coming back to the emergency department, the pathology that has people admitted for days and weeks on end, cyclic vomiting syndrome. And so we did. And we started to put some things together. And that is when it came time to reach out to Katya, reach out to Dr. B. Lee, to Dr. Leventhal, and other members of the medical advisory board and say, hey, guys, we're developing this in-house right now, but it is almost like that starter loaf for bread. We're kneading it, we're nurturing it, but we're ready for you to get your hands in here with us and really build something beautiful. And with that, we were able to produce what I think is a state-of-the-art cyclic vomiting syndrome action plan.
That's awesome. You're into bread making, huh? Did that happen
I
with
am, yes, yes.
with the
Thanksgiving's around the
pandemic?
corner. My home's going to smell like a bakery. I'm pretty excited.
And now you've got starter that's what, 5 years old?
Yep, that's right.
Nice. That's awesome. What were kind of some of the key goals that you had in mind when you were designing the action plan?
Absolutely. So I think the first thing that we felt was very important to address for our patients, which in reaching out to the greater CVS care community was confirmed, is that we're pretty good at starting maintenance therapy. And by all intents, we're not bad when people show up to the emergency department. It's that gap in the middle when patients step off into that prodromal phase and they're starting to feel bad. How do we rescue them from that? And so that was really, in my opinion, the most complex inner workings of the plan came through the yellow zone section, which we knew was going to need to be impactful enough so that people could springboard back into the green zone, avoiding a CVS flare, and hopefully not being a combination of medicines that become so sedated that it takes them out of school or takes them out of work. And so that was the idea behind what we did. And beyond that, we knew that from a knowledge perspective, there was pretty real gaps in knowledge from our emergency medicine teammates on how to manage CVS flares. And so at the time, we had just the adult guideline. Now we have the pediatrics one too, which is amazing. But at the time, we patterned a brand new emergency room recommendation section for a problem-based intervention based on the guideline so that these patients could have their personalized tool at their fingertips.
Right. And I loved it when I could see it, and there was definitely a lot along the way. But one of the questions that CVSA gets asked, or people ask in, random support calls, or groups online, is, should I take my kid to the hospital? And that always terrifies me, right? I'm like, if you have a question, I would go. I remember doing that as a patient, right? Or my son being the patient. So as a parent, and it was terrifying, right? Because there were so many times, and it ended up coming down to anytime there was a change in the vomiting, if something was different. He has very indicative, you can tell when he gets dehydrated, his lips turn white. It's like so we always knew, right? But we had unfortunately too much experience with it, but not everybody has that. So
Right.
having this kind of planned out, and that way you can discuss it with your doctor, I think is amazing. So, I love that it was developed because I think it really can be helpful in so many different ways. So I know we're talking about the different colors, and we'll put a picture up so people can see what it is, because not everybody has seen it with as much as it is on the website. It's on the CVSA's website. Um, can you walk us through the main section of the action plan and how each part supports patients and their care teams?
Absolutely. That's a great question. I would absolutely direct everyone to the CVSA website to download a copy and review the image itself. But if we were to break it down, the Cyclic Vomiting Syndrome Action Plan really has four main components. The first is supposed to be the green zone. This is when we are hoping every person with their cyclic vomiting syndrome is well controlled and maintained on their medicine, and they're not having any baseline pain or nausea, and hopefully no vomiting. As we know, unfortunately, is the history with this disorder is there's going to come a point when those symptoms start to rise again. And at those initial outset of worsening symptoms is where you find yourself in the yellow zone. The idea in many of those instances, what so many CVS providers like myself and others do, is we're giving you a little bit extra. We're not slamming you. We're not doing the nuclear weapon option for CVS yet. We're trying to help recognize that early intervention with a slightly higher, maybe more optimized plan can springboard you back into the green zone. But then a lot of the times that actual duration period from going from green to progressing all the way through yellow gets you to the third stage, which is red. And many times that is going to be when we're giving our best shot at abortive therapies, but we probably need to go to the emergency department. And the plan allows for that personalization. It is, as Glenna mentioned, so important to recognize people who have a great deal of experience with cyclic vomiting syndrome and understand what their child or their own presentation differs from the norm. And the truth is that there are so many children who will look great in the morning and then they will just rapidly deteriorate. And so it is important to build that fallback plan of when do I seek care in the emergency department into this action plan. And then fourth and finally, you can imagine that there are thousands of emergency departments in this country and around the world. And truth be told, very few of those emergency medicine physicians, very smart doctors, very few of them are going to understand how to follow the guideline for cyclic vomiting syndrome. They may have no idea that we have an adult and a child guideline. But what the plan does is takes the information from the tool that's already been inputted, uses the weight, the height, the body surface area, and the age to output an emergency room plan that can even be copy and pasted into that ER doctor's note so that we know what meds to order, what dose, how to give it, and the closed loop communication back to the team member managing this patient's cyclic vomiting syndrome.
That's awesome. Were you looking to address specific challenges like the emergency room care with this plan, misdiagnosis, or making that communication between doctors easier?
Yes. So I think there is a huge problem with misdiagnosis, and there is, as you know, of course, there is a huge proportion of the population that has cannabis-induced hyperemesis syndrome. And in the emergency department literature, there's sort of a divergence where they think that CHS and CVS are two very different things, wherein most of the gastroenterology and neurology literature, we would say it very much appears to be more of a spectrum wherein one can trigger the other. So the problem that I have is that with many people who come into the emergency department and truthfully are positive in the use of cannabis and other cannabis analog products, then they get labeled a CHS and then the guidelines go away. So for me, the Cyclic Vomiting Syndrome Action Plan with my signature at the bottom means my patient has a ticket. It's almost like the golden ticket to get into Willy Wonka's factory. They take it to the emergency department. They say, look, this is my board certified whatever who manages my condition. This is what they want to be done for me if I come to the emergency department. And the currency is that pager or that emergency contact number that we put there so that the emergency team, if they don't trust the document, can give us a call and we can help action that patient's care. So I do think that there's a little bit in the way of knowledge gaps and probably just disbelief with some patients about what their true diagnosis is. I hope that the tool can also serve as a quality improvement and guideline concordant care tool for emergency medicine teams.
Right. And you're right. Having that, what you were calling a golden ticket can be so helpful, right? When you are in the emergency room, because really everybody wants the most expedient care. So having this is what works is awesome, right? Whether it's
Mhm.
on letterhead or the action plan, excuse me, you know, that helps so much. So it's great that that was factored into that. With, people that may be unfamiliar with using the action plan or the concept, how do you recommend patients, caregivers um, prompt their medical team to put this into action?
Absolutely. So there's a couple of different ways to learn about this. In today's digital age, I would guess that YouTube videos are the easiest. And so I do have two YouTube videos to help guide people on the plan. The first is for physicians or other advanced practice providers. It's really also designed for that general practice physician who is helping in the care of CVS. Maybe that patient lives in a remote area and there's telehealth with their gastroenterologist every once in a while. And so the CVS Action Plan facilitates that modern care model. So the one video is for the physicians, also to help align them with the left and right safety rails of what the plan can do and what it doesn't do. And so if you say you've got a 4-year-old who's 800 pounds, the plan is not going to give you any recommendations for weight-based dosing. So there is that, right?
Mhm.
But it's also going to show, um, it was one small case series, but I get asked all the time about ketamine infusions for cyclic vomiting syndrome. That is not in the plan. And so only things that are recommendations from the consensus statements within the guidelines is actually in the plan.
Right.
The second video is absolutely for patients or the caregivers of patients, parents, to understand what the plan is meant to do and how they can gain it and input their patient's information and even share it with their gastroenterologist, for instance, and get them to start following the sort of care model. And that's been something that has been going on since we first published the plan in the Journal of Pediatrics, which has been really exciting that I get communications from other colleague pediatric gastroenterologists saying, hey, my CVS patient came in, they handed me this document, I had your email, can you send me the digital version? And we go on from there.
Nice. That was, I could say at American Academy of Pediatrics, it was crazy. with everybody coming and just how much, they wanted information on CVS and caring for patients. So yeah, we ran out of things very quickly. So so I get that. It's a area we need to focus more on, especially with, like you were talking about, the release of the um, new pediatric treatment guidelines.
Yes, ma'am.
Okay, what do you feel are some of the most important things to include when completing this action plan with your provider?
I think that if you are the provider and you're sitting in the room with the patient or the child, you have to make sure that you are putting in as personalized of an approach as possible, because that's supposed to be the idea that this is a scaffolding and you guys have to fill in all of the meat between the ribs. So what I mean by that is, especially in the yellow and red zone, we want to figure out what is going to work for these patients. One thing that's just sort of standard in there is the use of Queasy Pops, which I love. But there are other people who want the Pedialyte Pops or you name it. The sky is the limit. I think that if we are not personalizing these tools specifically for the patient, we're doing them a disservice. There's no point in using an action plan that's just stock. The thing that hurts my heart the most is not using the plan. It's when, a stack of 100 is just printed out and they all say the exact same thing. And we're just
Mhm.
handing people the same thing. It's got to be personalized. So I think that's the biggest thing. And
Yeah,
that requires a shared decision making model with, longitudinal discussions, iterative sort of discussions with that medical team to make sure that the ideas are flowing and that we're concocting the most efficient and the safest plan for that patient with CVS.
agreed. Because there is such a spectrum with CVS, right? How it
Hmm.
impacts them, how it's treated, the medications used for it. That was something I always talk to people about, because people tend to give up so easily on pursuing medications, right? And I'm like, it's not a quick process. It's very trial and
Hmm.
error. And it can, for us, it took 6 years before we found something that worked. And I will tell you that, my son wanted to give up more than once.
Yep.
So having that personalized, I think is awesome. A way to do that, because the stuff that works for my son doesn't work for everybody. My
Hmm.
son failed all of the typical medications for CVS. So it does. And there is such a spectrum even of antiemetics, and what works for this kid isn't going to work for the next kid. So,
You
um,
got it.
so I love that. I feel like the action plan can also be almost a jumping off point for even adults to use
Hmm.
to help guide that same sort of process, that you can have your doctor put something on a letterhead and, you know, for you to take to the emergency room. It's the same concept, and it walks you through those steps. So I love that it is the stoplight colors, right? This is when you're good. This is when things get a little sticky.
You got it.
And then the red is all right. It's time to go. So I love that it's developed like that. One of the top things that I think when you sit down and actually look at the action plan, I feel like it can really be a tool to help you develop your sense of CVS, right? What your
Hmm.
CVS is, because it makes you think when, similar to migraines. I have migraines, so that's kind of my association. And my son has a lot of the same triggers that I do for migraine, is, like learning when to take the medications. I think that's something that we need to capture a little bit better in CVS. Um,
Hmm.
because it's, for migraine, if I hit a five, I'm done, pain wise.
Right, right.
I can't catch it. If I can't catch it by the time I hit five, I'm just going to be out. And it's, kind of the same thing with teaching my son to use his medication. And that, I think the action plan could be utilized very much like that, right? That you can break it down a little bit more um,
Hmm.
to do that. So I see the action plan being a tool in your CVS toolbox in so many different ways. So that I love that. We actually have CVSA has the action plan listed in a couple places on the CVSA website, that and one of them is under the resources for schools, because I feel like this can be very much, something that you can help your um, teachers, people at school understand CVS a little bit better and
Hmm.
where you start to struggle. So they can also help you kind of recognize, because my son doesn't always recognize, or didn't, he does now. Um, you know, Something that I would see, we have panda face. We call it panda face.
Hmm.
The eyes get sunk, the face goes really white. Um, and he wouldn't always catch it, in
Right.
time. And we had to start learning those earlier and earlier. And so I feel like something, like the action plan could be very helpful for schools so they know when to recognize and, when kids are going to need, possible abortive medications. Do you feel like there's, well, first of all, do you feel like it would be helpful in a school setting? I should ask you.
Oh, yes. So that's definitely one of the things that parents have provided feedback that it's very helpful in school. At my hospital, we also have a very large metabolic center, and unfortunately, a high proportion of children in our metabolic center who have cyclic vomiting syndrome. And many of those patients are very debilitated, even separate from CVS. They have
Mhm.
home nurses. And so the other cool, unexpected bonus of the CVS Action Plan is that it has completely replaced the old archaic written nursing orders for home care. My home nurses, we
Nice.
make sure that they, again, review the same videos we talked about, that they
Mhm.
understand how to use the plan, and then they are off to the races. And I will say that we had anecdotally a resounding decrease in the number of children requiring resuscitation in the emergency department because the plan was able to help keep them at home safely without having full clinical deterioration needing IV fluids.
Wow, that's amazing. As a parent that also had home health, yeah, stuff like that. Because a lot of times they'd be asking us because they didn't have enough information. So
Exactly.
having
And
stuff like that,
you can't get a doctor's change to nursing orders at 10 p.m. at night, right?
no.
And so this is supposed to, again, provide that safe netting underneath. But if this happens, respond accordingly and do this.
That's awesome. So you are finding other uses for it besides the clinical. That's amazing.
I think so.
What advice would you give to physicians who might not be familiar with CVS, but want to use this plan with their patients? I'm assuming it's going to be at least part of the go watch the video. We need to get the
I
link
would
for that.
I think so. I think watching the video is certainly step one. The other truth is that the guidelines have been developed for adults and children to be very handy, to provide tables that you'll see similarities and themes between the manuscripts and the action plan itself. And so the action plan was designed to complement the guidelines. It is not going to present anything new. You were to read the guidelines all the way through, there's nothing that's in the action plan that is different. All we have done was compressed all of that knowledge into a single one sheet handout that is injected with the code that I created so that it makes your job easier. I think the other thing we talk about with gastroenterology and neurology teams who manage CVS is okay, this is going to make me have to do some extra clicking, and that is clicks is time, time is money. Is
Hmm.
it really worth my effort? The CVS Action Plan also reads itself and completely writes your progress note for you. So you are in no way duplicating efforts. If you open the document, you write your plan for this patient, you can copy and paste what is a beautiful guideline concordant. You're going to be able to code a high complex encounter for RVUs on that date. The note's written for you.
That's awesome. Do you have any updates now that the guidelines are out? Because I know the action plan came out before, but I know you worked with a lot of the team that was working on the um, updated pediatric treatment guidelines. Do you have anything that you think
There's
needs
a
to be updated?
There certainly needs to be an updated review of the plan, and Dr. Rosen and I have talked about doing that. Katya and I have talked about doing that, and so that's certainly on the horizon.
Hmm.
I was spinning other plates this year with studying for my boards and
Oh,
such, so I haven't
yes.
haven't gotten to it yet. But that's certainly the one. And I think the second idea that when I interact with some of my colleagues and other parents too is that the meeting place of this tool being a PDF is helpful, but it could be better.
Hmm.
Having a PDF has its limitations. It's really hard to travel with you digitally. And so we're trying to figure out a way, can we make a website or almost a progressive web app that allows for patients to log in, show it on their phone to the ER team, or even can a patient grant their gastroenterologist a login, and we do it this way, HIPAA secure, good messaging, and things like that, so that we have a better repository of this. Also, allowing potentially for other quality improvement evaluations and analysis of this sort of clinical decision support.
That would be awesome. I use a few apps like that, when you're working with medically complex people. Having something that keeps, because we go to different hospitals, and trying to
Hmm.
keep all the records in one place. Versus when I started with stuff with my son, even trying, our diagnostic journey completely, I would travel with his medical records. They'd go to work with me because I never knew where we
Oh
would
yeah, you
end
had the
up at
big
night.
binder, right?
I had a bag because mine was too big for a binder. Um, yeah, I'm like, I think ours is close to 5 reams tall
Uh-huh.
of
Yep.
paper. And it was so yes, having digital records for me, that's I am very much about trying to limit, the paper that I have because of that, but having it all in one place is awesome. That would really be helpful. So that
Hmm.
we get the same thing with the action plan is, people want the drop down, the easy fill out because it really is, you guys are very limited on time. So making it usable that way um, can only make it better, right?
You got it. Yes, ma'am.
Right. So what's your hope for how this plan can change the way CVS is managed in the future?
Well, like we talked about at the initial part, I think we do a good job on maintenance. And I think we've been able to anecdotally show that patients are much more actualized to care for themselves at home, especially in the yellow zone. And it's really hard to capture that and then publish that sort of research. But that is my personal truth, is that we're better at home. What I really think that this plan has the potential to do is early abortive care in the emergency department, problem-based abortive care, so as to either avoid hospitalization or at least decrease the length of that hospital stay. That's what I'm hoping we see, because there are other children's hospitals who have published some retrospective reviews showing early initiation of that abortive therapy in the ER can decrease length of stay. So I'm hoping that the plan as an adjunct and education piece, even for an emergency medicine doc who may have never seen a patient with CVS before, I'm hoping that it leads to rapid care and resolution of these flares.
Right. Because the early treatment, yeah, of CACHA's facilities doing a lot of that work. And
Hmm.
I wish if there was anything I could drive home, talking to a lot of medical professionals is, yeah, the sooner the better.
You got it.
So, I'm one of those that can attest to that. It's the longer we wait, the harder it is to get it under control.
Hmm.
Perfect. All right. Well, Pat, thank you so much for helping us get a better understanding of the CVS Action Plan. Before we wrap up, I have a couple of questions that we're going to be asking everybody that comes on the show.
Okay.
Um, so take a minute to think about it because I always go, man, I could answer these in so many different ways. But is there something you want people to know about CVS? See, so many different ways.
There are. Yeah. I think my biggest takeaway, and this is after great discussions with Katja, Dr. Lee, and other great experts in the field, is that CVS is not and will never be a one size fits all. We do our very best, as you discussed in great detail, with trial and error of medicines, but there are more often than not times when we're doing combinations of things that even as experts, we've never done it this way before. And
Mhm.
if it works for that patient, amazing. But we always need to be willing to understand that this is an ever evolving problem, that we're needing to look at psychotherapy, we're needing to look at medicines, at diet, at supplements, and making sure that we're leaving no stone unturned so as to provide the greatest chance for a positive outcome possible.
I love that. And I love that there's alternatives, right? One of the biggest changes, if you asked my son, what was the biggest thing that you did to impact your CVS? He would tell you managing his sleep,
Hmm.
his sleep patterns, which is not easy with a young teen, right?
I
Um,
got it.
so
Yeah,
yeah. But he did. He was the only 13-year-old you would know that if you went to his house, you knew everybody was going to bed at 9 o'clock. So I love that. Thank you.
yes,
Uh,
ma'am.
and lastly, as a part of a campaign that CVSA has been doing for several years, if you could describe CVS in one word, what would that word be
Debilitating.
and why?
These are my patients who need the most. They need the most love. They need the most medicines, the most care. And I am very, very lucky with the way that my institution allows me to template visits, that I can see these patients frequently. My emergency department has a residency. These are hungry, lifelong learners. And so we've been able to do great things, I think, for our patients with CVS, but there's always work to do. The illness is highly debilitating.
I agree. Thank you so much for that. And thank you so much for sharing everything that you have today about the CVS Action Plan, and for joining us with this. We would like to remind everyone that the CVS Action Plan and treatment guidelines that we talked about on the episode are available on cvsaonline.org with many other resources, information, community connection, support options. Check out Dr. Patrick Reeves at Wild Child Medicine. We look forward to what comes next. Thank you for listening to Episodes, a podcast by the Cyclic Vomiting Syndrome Association.
We're here to amplify CVS perspectives, spark meaningful conversations, and help change the way cyclic vomiting syndrome is seen and understood. Don't forget to like, follow, share, check out resources on the CVSA website, and keep conversations about CVS going.